lot that health care is a big drain on our state budget. Do you believe that the state government, sustenance, as you know, was passed last year, do you believe it is the right vehicle to deliver health care to state citizens and is cost effective? Mr. Mayor, Mayor Bob, we'll begin with you.
Look, I think that all of us want some kind of health care reform. There's no question that we have a system that has a lot of challenges, a lot of problems. Albeit, we also have a system that's probably one of the best in the world, as bad as we beat up on. The problem with sustenance, again, really comes down to cost, and really comes down to, is this really a foot in the door towards a single-payer system in the state of Connecticut? And I believe it is. I think that's one of the reasons why the governor was opposed to it. The fact of the matter is it just represents another entitlement program that we're going to have to provide to people that we can't afford right now. That's, it's a tough thing to say, but the fact of the matter is we have to have a government we can afford, not necessarily a government that provides utopia for everybody. In the future, down the line, healthcare has to be part of a larger, more global discussion about, here in the state of Connecticut in particular, and its costs and controlling costs. But in the short term, until we get our budget under control, and until we get our legacy costs for healthcare, which is another issue, but there's a $24 billion time bomb out there of retiree medical costs that we have to figure out how to fund. It's going to be awful hard for us to cover more people or carve more people into coverage and stick that bill to the working men and women of the state. So I think we have to be careful about rolling out new entitlement programs. Sustenance is just another entitlement program that we won't be able to afford. We'll end up being bankrupt, and you out there in the audience will have to pay the tab for it.
Governor Fidelli.
Thank you. At any point in time in the state of Connecticut, between 94 to 95% of our citizens have some form of health care coverage, be it through private pay, Medicare, Medicaid, our Husky programs, or through Charter Oak. So the issue that we're trying to resolve here in Connecticut is what I call the 5% issue, on 4 to 5%. And unlike the federal government, I think our approach to that should be to address that 4 to 5% and not throw the baby out with the bathwater in programs that many people are happy with. We're probably concerned about the cost, but the quality and accessibility of health care in Connecticut is far beyond better than many, many states and many nations. So sustenance will do nothing but add more zeros to the left of the decimal point of the deficit that's in the state. And working taxpayer, middle-class families in the state will continue to pay for that. We cannot afford sustenance. That is why the governor vetoed it. That is why it was overridden. None of the legislation related to health care that passed last year and then was vetoed by the governor helped that 5% issue. All it did was bring more people into a pool who had health care. And that is the wrong way to go. We need to, if we're serious about health care, to maintain the quality, the accessibility, and the affordability of health care. We need to look at that 5% in the realm of everything else, not throwing out of the other 95% and saying, well, that's bad for you because it's working for you. We've got a better plan. Sustenance is the first step toward the single pay system, which is going to bankrupt the state and will not do anything to basically provide better, accessible, quality health care in the state of Connecticut.
Thank you, Governor. Ambassador Foley.
One of the biggest challenges we have in the budget currently is the out-of-control healthcare costs in the state of Connecticut. Our Medicare cost per capita in Connecticut is double the national average. One of the problems that you have, one of the reasons I'm running for office, and I think I'm the best candidate, is I'm not a career politician. And I am not part of the problems that have developed up in Hartford, and I think I can come with some fresh ideas and perspectives. The last thing you want is a government-run healthcare program that is controlled by politicians, because politicians cannot help resist the temptation to provide benefits to their constituents and to not want to pay for it. So in the healthcare system, what happens with public healthcare programs is the politicians keep raising the benefit levels, and the costs go out of sight, and they offload the costs onto the private sector. And that's what's wrong with the healthcare, or ill-conceived healthcare plan in Washington, and it's what's fundamentally wrong with the concept behind sustenance. I think the goal of having everyone covered by health insurance is a worthy and legitimate goal. I think it should be left to the private sector to figure out how to do it with the guidance of government, but not government-run health care programs. Thank you.
Thank you, Ambassador. Oz Riegel.
Thanks very much, Dan. I agree with everything that's been said in terms of the sustenance program. Let me talk about this from an opportunity standpoint. I think healthcare, as I said a minute ago, is one of our great opportunities in here. When you look at the number of healthcare insurance companies that are here, the fact that we've got 2 top-tier medical schools, and we hope we do in UConn and Yale, the investments that both those institutions have made, the opportunity to bring more research scholars in here. I think the way that healthcare has to be looked at is as an economic driver. Currently at the Alliance, we have a healthcare working group that's looking at 4 major areas. We do need to put health information system in place. Looking at the way costs are eating up our hospitals and driving up costs in the healthcare insurance area, we have to look at some creative ways to bring those costs down so that for those of us who are in the private pay area, it's more affordable, and that we can continue to bring high-quality care here. So in addition to agreeing with everyone that's been said about the state staying out of the healthcare system, I think where the state can play a constructive role is leveraging the assets we have in the healthcare arena, being more creative as how we bring both the hospitals, the docs, the insurance companies, and the research capabilities into this area, where we can work together on both controlling costs, making healthcare more affordable, and driving the high quality. One of the things I just wanted to touch on in my first comment is the opportunity for greater research dollars that can come into this area. If it's done on a more collaborative, collective basis, it will do 2 things. Increase the quality of care, ideally reduce the quality of care, and bring jobs here as well.